Does mammography screening reduce breast cancer mortality? Past randomized controlled trials showed a 20% reduction, but since then, treatment has advanced. We could need an experiment where some women are more or less randomly referred to mammography and others are not. In Denmark, we happen to have had such a natural experiment. For several years, screening was only partially implemented. In regions without an organized screening program, general practitioners could refer women, even without symptoms, to mammography at the hospitals. The referral rate would depend on the GP's preference towards mammography screening. Some GPs would be in favor of screening and others would not. We could have a woman that, depending on her GP's preference, would either be referred or not. This is the experiment. We dichotomize the general practitioners into those referring more than expected and those referring less. When we compared these two groups of women, they were similar with regard to a range of risk factors. When we followed women for approximately 9 years, we found that women affiliated with a practice referring more had a 20% lower hazard of breast cancer death. Is this due to more frequent referral, or could there be other explanations? What if women search for a GP that would match their own preference? Death from external causes has previously detected these kind of subtle differences, so we applied this negative control and found that the groups were similar. Could it be that GPs improve breast cancer mortality through other means than referral? Well, we repeated the analysis on Fulan where screening was freely available to all women and found no effect of GP's preference. In other words, when removing the referral component, the groups were similar. So where does this leave us? Going back to our initial question, does mammography screening reduce breast cancer mortality? Well, we found that some sort of risk and preference-based screening did, but how this can be compared to a national screening program is not straightforward. In an organized program, every woman is invited, not just the marginal. Want to know more? Have a look at our paper, just published in Epidemiology. My name is Mette Lise Lousdal. I'm an epidemiologist at Aarhus University in Denmark, and this study was a joint effort with my brilliant co-authors.